Warning, the following video is extremely disturbing. You've been warned.
Be bullying and hateful will just come with facts. Never ever said I was sunshine and lollipops and rainbows everywhere. Ooh, the bloody alleys. But so I thought I'd come as evil. I don't know if this is evil smoke or a smell. I haven't quite worked it out. But I am loving this because I do feel pretty rough today. Even though I am 6 cups of Java in. Oh look, a cup of sunshine for you. Because obviously I'm sunshine, lollipops and rainbows apparently. That's what I claim to be apparently. Cheers. Sally, fueled by cafe. Caffeine even, not cafe. Cafe au lait. And yes. I'm rocking this look today. I feel I want to be evil Sally. Did you all watch the Kirsten last night? Did you all watch Chronically KiKi last night? If you're not blocked. Add to album. Yes, and I want to add it to KiKi. Ba-dum! I'm trying not to dox people. I'm trying my hardest, you know, like my friends generally. I have got another one. Generally, I've got my friends on video call. We've got a little alien family. And we do video calls while we're trying to get evidence together. And we're doing stuff in the background that you guys don't see, which is coming along nicely. And yeah, so we're always on a video call. So when we take screenshots and stuff, I'm doxing their faces by like, and they're always looking like this. And obviously they're not happy about me doing that. So I try not to. I feel so poorly today. Just got back from urgent care. No Disney Fast Pass. CJ. Oh my God. Glad you're live as you always cheer me up. Oh, thank you. Oh, I love that. I'm sorry you didn't get a Disney Fast Pass. I don't know where you get one of those from, but ask Kirsten, please, because she changed the tube again in a couple of hours and had an IV in her thumb. Oh, my God. Anyone missed any of her lives? I have them on my YouTube channel. Look at that now. If you're blocked from her lives and you're sad, and you want a bit of a laugh, the Observer has got it on her YouTube channel. Yes, not the thumb. I love the thumb. Okay, so I used to work in early years. I used to look after around about 150 kids, not on my own obviously, because that would be just crazy, between the ages of 2 and 4. And I've got to say, we used to have a careers day. Well, we used to make a week of it, but we used to have professionals come in for the day, and then we used to set up scenes for them. So we used to set up like a shoe shop, a hairdresser's shop, and we had a nurse, we had a hospital where we had some x-rays that they gave us and bits and pieces. And that thumb, some of the 4-year-olds that worked at my nursery could have done a better job with that thumb last night, just saying. Right. Ooh, what are we doing today? So yeah, I have got a new look today because apparently someone said that I pretended to be sunshine, lollipops and rainbows. I never have pretended to be sunshine, lollipops and rainbows because I actually have a very dark sense of humour, as most chronically ill people do. However, the lives will be factual with debunking things that she's saying. I won't be here calling her names because I'm not 12. And so, yeah, this is my reaction to being called sunshine and lollipops and rainbows. As you can see, I am not. I am far from it. And guess what? I don't give a fuck. I got no fucks to give. I don't give a fuck. I got no fucks to give. So anyway, it's scaring you. I'm really sorry, but I actually prefer it to me today. I'm so sorry it scares you. But it's still me. You can see, look there. It's still me. Ooh! I've got no makeup on, look rough as old dogs, and I couldn't bother to put makeup on. And actually, I couldn't be bothered to wash my hair. So I plaited it. And then I thought, oh, please tell me I'm not frozen. Right, Victoria Cross, I'm going to answer the thing on benefits. I have not in any way mentioned her benefits because, to be fair with you, her mental health problems, she would qualify for benefits, okay? doctors still treat people with fictitious disorder is all I'm going to say from personal experience. Cheers, mother creature. Egg donor. So, but a lot of it, she's getting it. Sally, look for iGift took intestinal failure on Facebook. Yeah, we've got that. I think we've got that one. Yeah, got that one. I've got them on my thing if everyone wants to see them. All right, okay, let's do this. 135 people. I know it's Saturday, so a lot of people are out enjoying the sunshine and actually having a life. I'm not having a life because at the moment my life is dedicated to getting this lady some help and getting her off to internet. So, yeah, the filter looks like a good character. I think I would make a great game character. Woo! But it is, yeah, I am. Apparently, Secret Haven, apparently, I think I am sunshine and rainbows. Of course, whatever you believe. Right, let's do this. Should we start with something funny first, just to get you all in the mood, shall we? Should we start with our usual? Like, we start and end with it. I thought... Right, some of the things are not saving on my phone, so I'm going to have to flip about a bit. So, bear with. Bear with. Is she live now? Excellent. Can I just say, I'm absolutely loving the fact that everything I've debunked this week, she is now using, that she has to have. So the clean touch, she said, my authority, it's just clean touch. And now she's saying aseptic, non-touch. Because that's what I pulled up that her authority is using. We must be causing her chaos. I absolutely love it. And I said about her carers wearing PPE, if anyone was on her live yesterday. Oh, hello, lovely. Hello, KiKi. It's not that KiKi. Yeah, she was saying about her carers and stuff. And I was like, well, if she was neutropenic, they would be in PPE. Her carers came in yesterday and she was like, I just got to get my PPE on. Which I absolutely... I'm loving it. I'm here for it. I'm absolutely here for it. I can't tell you how much I'm here for it at the moment. Sorry, Kirsten. Boo, your bubble. I'm here to be the pin to your bubble. So just to remind you all, Kirsten is a very poorly creator who is paralysed.
I got do, push pineapple, shake the tree. I got do, push pineapple, grind coffee. To the left, to the right, jump up and down and to the knees. Come and dance every night, sing with a hula melody. I met a hula mistress somewhere in Waikiki.
By Black
She was
Lace.
selling pineapple, playing ukulele. And when I went to the girl, come on and teach me to sway, she laughed and whispered to me, yes, come tonight to the bay. The lovely beach and the sky, the moon of Kauai, around Calypso surround, we'll all be singing this song. I got do, push pineapple, shake the tree. I got do, push pineapple.
To the left. I just thought we'd start with that because it's a little bit upbeat. So that is Agadoo by Black Lace, if you want to know. It's an old school. Right, I'm going straight in with some stuff from yesterday because genius gold over here. Genius gold. If I'm flicking from sources and whatever, it's because I want to get this right. We're going to be factual because we have to be factual. And I'm going to throw it out to, it's Agadoo, and it's Black Lace. It's an old 80s classic caravan club classic. There's lots of them, like the Chichiwa, and I just think it's funny. I think it puts everyone in a good mood. You can't be sad while singing that song. You know, you can't be sad. I don't do, now that's what I call depression one or album one or whatever. I don't do sad music because I like, yes, an old Haven tune, old school tune. I like things that are just a bit cheesy sometimes, especially when I'm feeling down, because you just smile. You can't not. Even if you've got limited mobility, you can do, do, push pineapple, shake a tree. Do you know what I mean? Right, let's do this. Kirsten, I hope you've got a pen and paper ready, or the mods, please, to try and undo some of the things that I'm going to prove today. Do you want to get your pen and pencil ready? Obviously, there's only 166 people in the chat you have to write down today. Mods, if you are in here, please listen to my facts. And if it just makes you think, well, that's not right, you are welcome in here as long as you're respectful to my chat. If you're not, you'll be yeeted. But please, you know, you might want to get a couple of biros on standby for all the notes you're gonna have to do today. All right. Oh, oops, upside your head. Say oops, upside your head. Say oops, upside. I might do a video to that. Thank you for the suggestion there. Song name, please. Can someone put Agadoo Black Lace in the chat, please? Right, which one are we going with first? Let's have a look where I'm going to go. Let's have a look where I'm going to start. Let's try this one. Shall we start with this one?
NES, I have NEAD. So yeah. So it's non-epileptic attack disorder and epilepsy. So not PNES, although it was originally misdiagnosed as PNES.
Because she said it was PNES. Just go back on her old videos. They're all still there, guys. She said it was, but apparently it was misdiagnosed. Whether that was by herself or the fictitious consultant, that's your decision to make.
Although NEAD and PNES are very similar, so yeah. But yeah, that's the conversation I was having with someone, was about FND and PNES. But that was a conversation I was having with someone. But they've put all of my diagnoses together and tried to make up some other diagnoses that I'm claiming I have, but I've never claimed to have them. So
I didn't actually cut two conversations together, Kirsten sweetheart. I actually got it off your profile page. Off your page, I went back to the future, remember, in my DeLorean. And I made it up, if you remember your first thing there. I did not cut two conversations out. It's there for you to see. I'm more than happy to stitch this video with your own video that said you had FND. I do know that your dad also told people that you had FND. So it wasn't me. It wasn't me. I mean, you know, I got better shit to do. But anyway.
I don't know what they're talking about. I just really don't feel well. I don't need to sleep, darling. I'm not tired.
Can I just say, right, I've got to say this. I've worked out how she does a throat. Every so often you hear her make this pathetic because it makes your throat sore. Every time her voice starts normal, she goes so it makes her throat sore.
I feel really dizzy, sweet. That's my sugar levels. I just had a glucose not long ago, but I'll check them again. I'm not tired, guys, and please,
going
in the nicest way possible, don't tell me what to do. This is the safest place for me to be right now when I'm alone at home.
Voice is going normal.
So yeah, like, not me, but I'm not tired, and also it's unsafe for me to be alone, which obviously TikTok isn't the answer, but also
Oh, I'm glad we agree on that one, Kirsten. TikTok definitely isn't the answer. And if it's unsafe for you to be alone, do you not think services would be put in place, or you'd actually be in hospital? Using people, moderators, to manage your care plan is not the ideal. So I'm glad that we understand that TikTok is not the best place for you to be, because you are triggering people with chronic illnesses, because you are not putting out the messages and the trials and tribulations that they deal with. You are also giving unsolicited medical advice on medications and stuff. So I think we can all agree this isn't the best place for her to be.
so I have no other answer right now, so
Coffee.
thank you, but please, yeah. I have an NG and an NG. I've had abdominal tubes, which was a peg J, and I can't have another one because it failed and it's caused damage, so it's not something I can have again. But also just because my surgeon won't do it again, because it's not something that I'm from, so it's actually adding another infection risk, which I've got a very weakened immune system already.
Now, is it in a weakened immune system? Because I have shown you yellow antibiotics going in her NG tube, up one nostril, and coming out of the gastric tube. Is it the fact that she can't get rid of it, or is it the fact she is draining her antibiotics? I mean, anyone can have an infection, okay? If you're sticking things in you, like thumbs, or fingers, or legs or feet, you are going to also, you're reusing needles, which you have actually said yourself, you are going to cause infections. Now they give you antibiotics and you put them in your tube and drain them out your tube. So anybody, it's not resistant to antibiotics. You are actually draining the antibiotics and it's not going to work. You know, it's not going to work. There's nothing you can do about it. So is it that she's resistant, or is it that you're taking her antibiotics away? Do you know what I mean? Is it? Anyway, just a pause for thought there. Just a pause for thought. Trainer, I showed my nurse both, and yeah, of course it is. Of course it is. Oh, we know what the rash was caused by. Apparently it's not a rash. It's 3 places now, but we'll continue to talk about that.
Sticking to nasal tubes for me, and that's what my gastro has decided. And they are also
Right, let me cover this bit again.
I have an NJ and an NG. I've had abdominal tubes, which was a peg J, and I can't have another one because it failed.
Yes.
And it's caused damage, so it's not something I can have again, lovely. But also just because my surgeon won't do it again because it's not.
I don't know if I can do this. Yes, you can.
But also just because my surgeon won't do it again because it's not something that I'm from. So it's actually adding another infection risk, which I've got a very weak immune system already
something, so a
with infections. So it's a lot better sticking to nasal tubes for me. And that's what my gastro has decided.
Also, it was a clear
and they're
one,
also
so
a specialist, and that's also what my intestinal failure consultant has decided as well.
Obviously, it must be Dr. Harry Raj, because we all know that's her consultant, yeah, has deemed. And actually, he would be her intestinal consultant as well, just saying, because he covers that as well. Has said that she can't have these. She cannot have these. Hi, Paul. Welcome.
Also, they won't actually do a surgery on me ever again, so yeah. That kind of stops them being able to do a peg J. I'm not well enough for surgery, unfortunately, anyway, regardless. So, even if it was a life-threatening surgery, life-saving surgery, there's...
I claim bullshit. If it was a life-saving surgery, would they give it a go? Of course they'd give it a go, you muppet.
Probably a slim chance they would do it. Not unless I consent, but also have a very big chance of dying if I don't have it. So if there's a chance I'm really gonna lose my life, then they might be able to, but yeah.
Guys, I can't see the pinned comment. I'm on TikTok Studio. I can't see pinned comments. There's no point pinning them because I can't see them. Thank you, by the way, Summer Wiggles, Victoria, Bones. Laura, Judy, Elle, Burgers, Michelle, Holly, Geo, Wifey. Because I don't see gifts come on the screen. Neither. It comes in a little tiny box, and I am very old. So yeah. Oh, by the way, but the vet tube's gone and another one's in. So that's 3 tubes in 2 days. She's got more than a Disney Fast Pass. She's got my bloody DeLorean. I'm going to check where the keys are. Oh, okay.
Can't do any just surgery just because. Do you get what I mean? Like, yeah. I'm not well enough, unfortunately. With all my conditions and comorbidities, it's not easy. It's a lot.
I know plenty of people that are a lot sicker than Kirsten, which they still can have surgery. A lot sicker. We have some in our community here, and if it was needed, they would have surgery. Just saying. Oh, you're still in the boot. Well done, Secret Haven. I didn't let you out. One second. It's very hectic in the Field household, so I can't take big comments. Right. It's very, very, very hectic. Right. So, yeah. Unless you have a DNR. See, look, that coughing stuff has made my throat hurt. See what she goes like. I'm not going to do it because it hurts, but where she does that to her throat, that's how she's making her throat sound. Yeah. I noticed it last night. I was like, I thought she was using the I can't come to work technique, but it actually isn't. She is making her throat sore.
More complex with having EDS as well.
Again, lots of people have EDS and lots of people do have surgery. Yes, it does mean that we are more resistant to anaesthetics, etc., etc. But most of I've had 2 C-sections. I've had gallbladder removal. I am constantly in with my teeth, and I have a cocktail. And my anaesthetist I have a meeting with, and they decide, because the first C-section I had, I went into shock because it didn't work. So it is possible. This is rubbish. It just means that you have to have a meeting with the anaesthetist, and they don't give you what they give an atypical person. So there we go. Thank you very much. You're welcome. In fact, I think I had like a fentanyl cocktail for my teeth last time. I'm quite sure. My first one, I remembered a lot about it. My second one, I remember the dentist saying she was going to do something, and the anaesthetist coming in. Don't remember anything else apart from the recovery room where I offered to give someone a lift home. Wasn't my car, but we took them home. Because I was off my tree. So it does work. Anyone else with EDS will tell you in the comments. You literally have to have a meeting with an anaesthetist. I don't advertise my illnesses because they are my illnesses, but I'm debunking that one, Kirsten, my love, because yeah, I've been there. Done it, got the t-shirt. It is possible. Yes, lidocaine doesn't work. That's why I can't have my teeth sorted in a normal dentist, because they gave me so much. I was drooling. I had to have sugary tea and biscuits, and still then when I'd finished, they'd put so much in me. I looked at the bus driver. This was years ago. I looked at the bus driver and I went, "Can you take me home, please?" And he said, "I don't know where you live." But luckily, someone on the bus did know me, and they said, "Are you all right, Sal? Are you all right?" And I was like, "Oh no, I need to go home." So yeah, it does work, okay? Exactly. But it does work. Emily, it does work. It does work. It does work. Absolutely, it does work. So I call bullshit. I mean, we're dribbling, but it works. Oh.
Breathing tube down.
Right. This bit, very interesting. Very interesting.
Unfortunately.
It's my evil.
With all my conditions and comorbidities, it's not easy.
Not easy. It's terrible.
It's a lot more complex with having EDS as well.
It's terrible.
It's the anaesthetic risk, because obviously they put a breathing tube down, but I've got a huge airway, just a huge airway and respiratory failure risk. So it's the anaesthetic risk, but it's also airway management risk, because I'm very extremely complex airway to manage.
If we were a very complex airway to manage, how did the air ambulance manage to do it? And the doctor that then went on the ambulance with you? If you had a very complex airway, how did that? Because she showed us the breathing apparatus. She showed us what they used. So if you had a complex airway, how did paramedics take over your breathing? Tumbleweed. Because you didn't have specialist equipment. You showed us the intubation equipment that the paramedics use, which is standard. It was standard equipment, which is in every single paramedic's bag. So if you had a complicated airway, would they be using standard equipment? Just food for thought there. And they've done it so many times. So, yeah.
Even with breathing tubes, I've been in ITU enough times, and they've found it very hard to manage with ventilators even. So yeah.
I cut some.
I Charlie love. It doesn't work for me with my EDS, so no.
No, it doesn't work.
Local anaesthetic just doesn't work in general.
And again, we've just said this. Emily's in here. She has EDS. Thank you, John. Thank you so much for the roses, Victoria Cross. Smells so good. Thank you. And Mel, thank you so much for your roses too. Smells so good. And a flaming heart and a football and a rainbow, because that's me. I'm rainbow, sunshine and lollipops. And a football and a TikTok. And Claire, my little sister, smells so good, thank you. Yeah, so anyone in the comments who has EDS, we will know that it is possible, but we need enough to knock a rhinoceros out, okay? We have to knock a rhinoceros out, that's all, okay? And we have to have yeah, bones. You don't need to send gifts, but thank you so much, I appreciate it. Yeah, so we can have them, but we just have to speak to the anaesthetist first, and we have to have a little bit of a consultation, and it generally involves a cocktail that they wouldn't give to the atypical person. Ta-da! John Mack. Ta-da! Thank you, darling. I hope you're well, John. How you doing? How are those competitions going? Yeah, so we do have it. My sister's in here. She has EDS. So there you go. I was knocked out from a section. Could feel the incision. That's what I did. My first one, I felt the incision, and they were like, you can't possibly, you can just feel pushing, you can just feel pressure. And I was screaming. I was like, no, I can feel pain. Lots of explicit beep 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 cuckoo cunt beep, in there, and it wasn't until I actually went into physical shock and my baby came out with an AGPAR score of 5 that they believed that actually, oh shit, she's telling, not, she's not fucking lying. So the next section I literally sat with an anaesthetist twice before my section, because I was literally like, no, I don't want this. I never want to do that again. This baby's going to have to come out another way. It's not coming out the hoo-hoo. It's not coming out the sunroof. You're just going to have to magic the fucker out, because I'm not going for it again. So obviously I had appointments, and they gave me like a Molotov cocktail, and I am pleased to report that I was okay with the second one. So the baby did come out the Ziploc sunroof. She's not still there like 15 years later. In fact, you've seen her. She's got my guinea pigs. Okay, so it is possible, Kirsten. So if I can have 2 C-sections, my love, you can have a little operation. I'm loving these ones, by the way. I'm not going to lie. Sam.
So they use it, like, inject lidocaine and stuff.
Oh, yeah, Kirsten, my sister has EDS as well, and she's about to have 2 knees replaced. Do you want to tell her that she can't have anaesthetic? Because she's under the impression she can. Just saying. Claire, you can't have anaesthetic, love. It doesn't work. John, I'm good, thank you, love. Claire, you can't have anaesthetic. Maybe take a paracetamol, darling. Yeah? Take a paracetamol, and you're going to be okay, boo. You have those knees replaced, all right? All right, I tell you what we could do. We could do a little bit of meditation. But you can't have anaesthetic. Kirsten says it doesn't work on EDS. So your knee replacements, I'm so sorry. Yeah. Paracetamol? Yeah. Yeah, boo. Paracetamol. Don't worry about it. It's fine. I'll bring some grapes in afterwards for you. Okay? No worries.
But it doesn't work, and sedation doesn't work either. Like
good.
Midazolam and stuff doesn't work.
Midazolam doesn't
not
work,
to actually sedate me.
Boo.
So yeah. So I had lidocaine injected to.
Claire, can you just drag yourself around like a slug? Because Kirsten said it's not going to work. So there's no point having your knees replaced. If you can just drag yourself along like a slug. If you could, that'd be great. Forget your mobility scooter, just drag yourself along the floor like a slug. It's not going to work. Yeah, it is working, Jem. I've got a filter on today because apparently someone said that I am not sunshine and lollipops and rainbows, so I decided I shall be evil Sally.
Drill an IO line, which is an intraosseous line into my shoulder.
Oh, love this bit. Love this bit.
I've got the scar from it.
Right. Now I'm zooming in because she moves her finger at the minute. All right, okay. Thanks, Tammy. I can see a mole but I can't see no scars, especially for someone with EDS as well, because our scars generally, you know, it's a connective tissue order. We have adhesions. We sometimes have keloid scars. Our scars are a bit scary, always there, okay? She said it's a circle with something in. I didn't know whether she had a BCG jab, but she was probably too young for that. But I cannot see absolutely fuck all on there. So then she moves it. So, okay, so all have a look there. You can see a grubby fingernail. If anyone wants to see this, okay. Yes, a scar in the room with this. I'd like to make an announcement. Could the scar please come to the front desk, please? Could the scar please come to the front desk, please? You are missing. Apparently there's a scar there. Yeah. Lost scar announcement. Could you make appearances to the front desk, please? Sally has some questions. It's, yeah, exactly. Yeah. Can't see a scar. But anyway.
You can see it's the ring with the dot in the middle there. The ring with the dot in the middle. So that's an intraosseous.
Can you see the scar just moved? The scar just moved. Lost announcement for that scar. How come you just moved? Like 10 centimetres. What the hell's that about? So we pointed towards our mole. So we went from our scar. If she can't find it herself, but listen to how long ago she had it.
Line that I had years ago, no, about a year ago actually, to get access when all my other access had failed. That's the only thing they could do to get fluids and medication into me. So it goes into the bone marrow. They drill a big needle into the bone marrow, and the lidocaine didn't work, so it was very horrible, I'm not gonna lie.
I got one from a boo-boo when I fell over. I've got 2 on the side from a bilateral release on both knees when I was 20. That was 30 years ago, and I can still see them. So if you want to see my scars, you know, you want to see my boos, we can all share the boo-boos. But, I mean, the ones that are 30 years old are a bit faint. But I think as well, I might have... oh, yeah, hang on. The cat scratched me. Oh, hang on. I feel the filter's going to... Oh, the filter's not going to do this justice. The cat scratched me. I think you can see it here. Yeah. My kitten scratched me and it's scarred. It's a little cat scratch and it's scarred, right? And that was about, I want to say about 5 months ago, Kirsten. And yeah, obviously I do have velvety skin. I do scar and bruise very easily. And, oh, look, my scar's bigger than yours and it was a kitten scratch. So, yeah. Anyone wants to show their boo-boos? Anyone want to show their boo-boos? I'm cutting these up. I'm cutting out the crappy bits. I'm literally focusing on what she's saying because I've cut out all the, hello, Danielle, darling, how are you? I'm okay as I can be today. I'm very poorly. I cut all that shit out. I've just gone to the juicy bits. So I've not edited it apart from to cut out all the, hello, yeah, oh, I'm very poorly. I cut all that out and that cut out a good 20 minutes, if I'm honest. So I just wanted the juicy bits. I didn't make it up myself. I didn't do AI. Obviously, I'm AI Sally today. But that's because I just feel rough as dogs. I look rough as dogs, and so I put this filter on. And someone called me Sunshine Lollipops. Shall we go into number 2? Let's go to number 2 videos. Remember, we are here with facts. It is not hate live, not bullying. I just want you all to have the facts. I am not telling you whether you should or shouldn't follow this creator or be half-wind. That's none of my business. But what I'm here to do is raise awareness that what she's saying is factually incorrect. And thank you very much for the flamed heart. Because I'm evil. Yeah. Usually, don't they do that bone marrow thing in your leg? I've not heard of people having it in the shoulder so often. But obviously, I can't tell you that factually because I'm not a nurse. Oh, no, I'm really sick. Yeah. But, I don't know if she had the BCG jab, but generally that did cause a round circle with a dot in the middle of it. I did everything. You know, they stamped you to make sure that, like, if your things came up, oh, look, there's my cat scratch. Oh, my scar. They put a thing in here, and if it blistered up, you didn't have to have the injection. I'm petrified of needles. Well, I was. I'm not so bad now. I bit the person that did my rubella jab. So I literally was, like, trying to get that thing to blister, because if you blistered up, you didn't have to have the jab. Yeah, if it blistered, you didn't have to have it. I was slapping it and scratching it. She's younger than me, and I didn't have the BCG. Yeah, exactly. I think as well, it depends which area you're in. If there's a high risk of Secret Haven, I don't know what you're talking about. Sunshine and lollipops and rainbows everywhere. Yeah. It depends what area, whether there was TB in your area. It used to be a national rollout, but obviously where people now move around the world, they have come back. TB is back in the country, so I don't know. I can't tell you. Yeah, some people are saying they didn't have theirs. Feral Sally. Yes. Yeah. Tap the screen if Kirsten annoys you with her lies. Take it out. Bang, 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 bang. Right, let's go.
Headaches, that sort of thing. But if the root cause is an infection, pain meds won't really touch it, darling. But I've been really sick as well with it, vomiting and stuff. So I've got to give it at least 48 hours to get them in my system properly.
Standard.
It really doesn't with cellulitis, darling. Cellulitis and pain meds they don't really trust me. Pain meds don't help cellulitis.
Okay, this isn't factually incorrect, and this is where we're just going to do this. It might not work for Kirsten, but it does work for other people. My children have cellulitis because they have cannulas in their skins permanently, and we're quite dab hands now at cellulitis because teenagers are grubby, and when they put their cannulas into the subcutaneous fat layer, they put germs in there sometimes. So standard protocol in the ranty house is that we take the gadgets off, pus comes out, we draw around it. If it spreads from the red area, then we go to our urgent care. Our urgent care dishes out antibiotics, and they tell them, because they're autistic and their sensory processing is off the scale. Now, Anya, if you scratch her, she will respond like you broke her leg. But when she actually breaks a bone, she don't feel it. So cellulitis for her is like end of the world. She's actually had to have an operation to clear out the infection because it didn't work with the antibiotics. So we're a dab hand at this, Kirsten. So it might not work for you, but it works for Anya to have pain meds to bring those pain receptors down. So not factual information. Okay. Yeah, we're going on to that bit. So I just want to debunk it there because it does. It might not work for her, but yeah.
Oh, they never have with mine. I get reoccurrent cellulitis. So yeah, no, never has.
Tell by your fingernails.
Yeah, I know how, me darling.
It's like my kids.
And my pain meds help quite a lot with my pain in general. And I'm on the strongest pain meds that exist, apart from one, so yeah. I'm on Morph and Oxycodone.
Dino, let's all give her hello. Dino in the chat. There's raising awareness and there's constantly making videos trolling her. You'll know better. Dino, until she gets off the app, lovely. I'm not going to stop. Am I trolling her? Am I no better? As a result of what I am doing, we have had a number of victims come forward, which are talking to the relevant authorities now, which if I had not have done this, they wouldn't have done it. So is it trolling? No, we're debunking things by facts. Is she putting out dangerous information? Yes, she is. Is she financially, emotionally and mentally grooming people? Yes, she is. Do some of those include minors? Yes, it does. Does some of those include vulnerable people? Most certainly, yes, it does. So if you don't like it, please leave my live. Thank you very much. Exits here, here, here. If you want to stay around and listen to people's stories who have been affected or listen to facts, please stay. I'm not here to tell you whether you should like this person or not, or be her friend or not, or follow her or not. I'm just here to stop the misinformation coming out. And do it in a humorous way because actually it's a bit boring to watch. Thank you. rant over.
Helping. Like, obviously there's a few that are stronger than that at home. These are like the strongest they really like to give, so yeah, like I don't want high-ish doses.
I'm sorry, Dino's responded again. Yes, she's harmed people, but how do you know you're not harming her? Pot, kettle, black. Okay, so this weighed really heavily on my mind before I started. This could hurt her. She could hurt herself, Dino. What she is doing every night is going to have the same consequences as if I'm doing this. Let's be honest with you. In fact, her way, she's going to do it quicker. Yeah? But she is harming more people by the day. And we're not talking 1 or 2 people, Dino. We're talking 30, 40, 50. We're not talking a few quids and a few TikTok gifts. We're talking thousands of pounds. We have been told by the police to use social media to warn other people until the relevant things can be put in place. It was agreed that her dad would take her off social media. It was agreed that her dad would stop her doing what she's doing, but he hasn't done it. So what's our choice? Do we sit here and put thousands of people's mental health at risk so thousands of people can harm themselves? What do we do, Dino? It's a bit of a social dilemma. So I chose this way. Whether you think that's the right way or you think that's the wrong way, my conscience is going to have to deal with it, not you. Thank you. Okie dokie. Someone else wanna read, talk to Dino, because I can't be asked. If you even had an inkling of what we're doing behind the scenes, yeah, an inkling, and how much time this has taken and what coordination we're doing, you wouldn't even be saying it, Dino. So please don't comment on things that you don't know. But when it comes to fruition, you spend more time watching Kirsten's every move than making sure your own child is safe. Is this a troll? How do you know about my child? How do you know about my child? And actually, I think that's bullying rather than what I'm doing. How do you know about my child, Dino? How do you know? Just been kicked. Hit the road, Jack, and don't you come back no more, no more, no more, no more. Hit the road, Jack, and don't you come back no more. Bye, Dino. Wah, wah, wah. Go on now, go. Walk out the door. Don't turn around now, because you're not welcome anymore.
So, no, I'm quite pale, darling, unfortunately. I'm just quite poorly right now, sweet, but I'll be fine. But then this infection's spreading and getting worse as we speak, so yeah, the infection is getting so much worse. Over today it's got so much worse. So the infection isn't being actively getting rid of right now, it's been getting worse. So obviously that's why my pain is probably getting worse too, because obviously the infection is getting worse and spreading, so yeah. It's spread like wildfire within a day. Even within 4 hours it's spread really badly, so yeah. It's not good, but it is what it is. Hey Maria, darling. It's in 3 different places, and yesterday it was only in 1 place. So yeah, it's literally. We only noticed the start of it yesterday evening, and by today I've now got it in 3 places. This evening I've now got it in 3 different places. Really hot, really red, and really angry.
No, it's meant to push.
It's crazy. You're a nurse, Angie, love. That's okay, thank you.
No, it's meds push. Angie's a nurse, by the way, right? Yeah, I'm pretty sure too. Right, okay. Can I just say my kids are fine? Okay. We do have 2 parents in this household. We also have another 2 adults, and we have another 2 adopted adults as well. So we're just fine. My kids are fine. Don't worry about my kids. I protect my kids. I safeguard my kids. And you don't have to worry about them. It's all cool. If you know what we've got in place for them, you won't be worried.
pick line and
actually, my kid would rather be with her guinea pigs than me anyway, just saying.
touch them because of the infection risk, and using a pick line and other lines trained me. So yeah, before you can even touch them, the infection risk and using aseptic and all that, it's a nightmare really. It's special training, not just standard bog standard nurse training.
Can I just say, Kirsten, I will take this as credit because you said your consultant told you it was clean touch. I was the one who said that your authority actually works aseptic no-touch techniques and it needed training and highly trained staff. So I'll take this as credit. Thank you. Thank you. Thank you. Thank you.
It's a bit more than that, isn't it? Aseptic technique, we love it.
Just in case you didn't hear that, she said aseptic technique. We love it. Not clean touch. That she said before, which we have videos for. Anyway.
Yeah. I know in hospital they really struggle to get people trained for pick lines especially. I don't have a pick, but I have a different sort of central line, so yeah. Well, I don't actually at the moment at all because it had to be pulled, but yeah, well, cannulas don't last for me, sweet. They last 24 hours maximum. I'm green. I'm not green, darling.
Oh, sorry. Yeah. Yes, Janine. We know this, but what? Liz, what? Oh, we're talking about sunshine and lollipops and rainbows. As I said, she's now saying that it's aseptic technique and not clean touch. So I thank you. I thank you. I thank you. I thank you. My factual information.
I've done some nurse training, yeah. I did, sweetheart. Yeah, it had to, unfortunately. I'm waiting for a new one of the infections. Oh, hey, Lauren, darling. Because of the infection, I do it till my cellulitis is cleared. The paediatric nursing.
Okay. Again, factual information. If you had a femoral line and that's the only way your body's getting IVs and stuff and it is broken and they won't operate you until your cellulitis is gone in, this would be an inpatient process. I'm sure any nurses in the chat would agree with me. If you've got someone that relies on the femoral line for hydration, are you going to leave her at home? I would say that she would be an inpatient and that she would be given IV antibiotics to clear it up quicker if her cellulitis is so bad that they can't put another femoral line in, which is her only source of hydration. Just, I mean, you know, exactly cellulitis protocol. I'm just saying, because again, if my kids couldn't have their insulin pumps on because of the cellulitis, if it spread, and we have had one spread, it's an inpatient thing. It's an inpatient jobby. Inpatient IV antibiotics, because it's a life-sustaining. Without insulin, they're dead in 3 days. Without fluids, pretty much the same. Yeah, Emily, thank you so much. You don't have to give sweetie, but you have to go. Right.
It actually fractured, darling. The lumen fractured, so I had blood coming out of it, so it had to be pulled anyway. But yeah, so it was clamped off. But obviously, a huge infection risks.
Thanks, Emily.
Part was at uni, part was done in hospital because I spent a lot of it in hospital, darling.
About a nursing.
So yeah, no, not a lot of uni, but I had, I'm not sure, sweet, but I had, because I had a SEN plan, it was called back then. I had a special educational needs plan.
It wasn't called a SEN plan, Kirsten. You can use this one. this week. It's called a statement. It was called a statement. You were statemented. Before the Education and Healthcare Plan came in, the EHCP, in 2014. And everybody from a statement was moved over to an EHCP by 2017. And I need to remember this because how old is she? She's 25. So what year would she have been at university?
2017.
It would have been 2017. So statements were gone by then. Gone. Now, I'm going to stop, but we will come back to it. I'll let her carry on, and then we're just going to debunk some of this, okay?
Care plan. So they used to support me to do outside of uni work as well, but it was a uni degree.
Actually,
yeah,
that's different, and I'll be interested to hear from you on that. I know, Moffy, we're going to cover that, love, because I've got a child this age.
but I didn't finish all my placement hours, so I'm not registered.
So she couldn't register as a registered nurse because she didn't do her placement hours.
Well, they have to make accommodations when you have a plan. It's lovely. My SEN plan was put in place when I was 10 or 11 probably, from
exactly finding it.
educational psychologist, and in place until you're 25. So yeah, they're not called SEN plans now, they're
You go no further than a
EHCPs.
college.
But yeah. But back then they were in place until you were 25, and mine was, so I was very lucky. So they had to do whatever it said on there, really.
Exactly.
They had to.
We will cover this.
And I had to do a lot of work, either online or through. Yeah, darling, it was, but Northampton, sweet, which is far from me.
But it's my hometown,
So I
Kirsten.
actually moved when I went there, but yeah. But I also wasn't quite as poorly then as I am now, sweet. My illnesses are progressive, so degenerative, but they also, like, I've had more diagnoses since I went to uni. I'm 25, remember, so I went to uni a while ago, to be
Big
honest.
up the shoe army.
It's been about the past 4 years it's gone really downhill.
No, it's not like that.
Not really, darling, to be honest. Help.
I love the fact that she said she went to university in Northampton. Can I just say, I loved it. When she said Northampton, I was like, shoe army, shoe army. It's my hometown, sweetie. It's my hometown. I know everything about it because I moved here. Oh, probably just about when you finished uni, I moved away from my hometown. So, yeah, I know everything about Northampton Uni. Yeah, it's great. Thank you.
Me self-manage and not need as help from other professionals, but it's still very hard. So like obviously doing aseptic technique and doing my own line and line management, like flushes and meds and IV fluids and all that sort of thing, I can do myself. Don't need to rely on district for.
Even nurses would probably agree that you wouldn't be doing that yourself. The district nurse would still be doing it, even if you were a nurse, because if you're chronically ill, you are a patient. Can you imagine a doctor, a brain surgeon, going, well, actually, I've got a brain tumour, but I can do it myself. Just got to cut this bit, flip it back. I'll do it myself. Yeah. Or can you just imagine? Oh, I'm a midwife. I'm going to do my C-section myself. It's all right. Just scalpel, pop baby out, sew me back up, all is good. Gastro team. I got a bit of pain fixing my gallbladder. Oh, it's like operation, like that game. I'm just gonna do it myself. Yeah, okay. So River Song said it's different. I can treat my dogs, even though I'm a vet nurse, but you wouldn't treat yourself. Oh, are they? Is she still after the actor gene? Bless. Sew it up. I'm all good. You have to be a patient. You have to be a patient. I'm not, Mrs. Chops, I'm not saying you don't train, but what she's saying is she qualified in nursing in Northampton Uni. So this is why she can do the procedures herself. She's not saying she's been trained. She's saying she qualified at Northampton Uni as nursing. She didn't become a registered nurse because she didn't do her placement hours. That is what she's saying. So I'm not saying about who trains her, or because yes, people can be trained to put NG tubes in. My friend is. So I get all of that. But this was the bit that she said was because resuscitation. Paramedic. Oh, I feel really poorly. I need resuscitating. Hang on a minute. No, this is because she said that she was as a nurse. I work in a nursing home. I'm a team leader, worked across the board, but she's full of crap. Thank you. If she doesn't do her place, yeah, she's not a registered nurse because she didn't do her placement hours, but she said she qualified. She got her degree at Northampton Uni. Yeah, exactly that, my love. Yep. Did she access to online course? Nowhere close to a nursing degree. Louise, because that person said I was sunshine and rainbows, I decided that I'd have an evil filter, because I've never said I'm sunshine and rainbows. Far from it. I have a wickedly dark sense of humour, and that's how I get through life.
Management, but my conditions can't get better, so it's kind of hard. But yeah, obviously I know a lot more about medication and in general, like, but my illnesses are just lifelong, so chronic conditions, so it is what it is. I'm actually not going to be saying right now, darling, because of the hate, but I have a lot of different illnesses, sweet.
I can't remember what she said. Okay, so here comes my favourite bit of debunking. All right. Kirsten. Psst. Higher education. What happens when a student, this is for post-16, educational needs and disabilities in England. What happens when a student enters higher education? The SEND system in higher education is separate to further education system. The Children and Families Act 2014 does not cover higher education. An EHCP plan cannot carry on to higher education. So it can go to college. When it goes to university, it's a totally different system. So your statement, as was then, if that's what you had, would not have covered you for university. It is indeed, as someone put in there, is the DSA, which is it a disability student access. Obviously there's things that can be put in place. As my daughter's a type 1, she would have a fridge put in her room for her insulin. She would have somebody to come and check on her. She would have access to laptops and aids that would help her. This is totally different, and this can be found on the Parliament website. Okay, you are not how can I put it, you're entitled to reasonable adjustments as an adult, okay, in the university setting, but your EHCP or your statement does not cover you for flexi learning or any of the other things that it covers you for in college or school. Number 1. Northampton University, they do adult nursing honours, they do learning disability nursing honours and midwifery honours. They do not do paediatrics. However, they do a children and young people's nursing, and it's a 3-year course, full time. So this is Northampton University where Kirsten went, everybody. So I just thought I would let you understand this, because obviously if she did adult stuff, she would not have done paediatric stuff. It's a separate course. Okay, so as you can see, this is the university that she said from my hometown. Big up the Shoe Army. There's an adult nursing course, and this has been applicable since Northampton University was upgraded. Kirsten, I don't know if you know that, but we weren't a university town, but we became a university town in 2014. So you're saying that you were there at 2017, so this would have been applicable to you. Yeah, so as you can see, sometimes there's an option to dual qualify, not at this university by the looks of it. But, other people that went to Northampton University, I would love to hear from you, especially if you did. Student nurse, big up. I'm doing the, there you go. I'm doing the registered nurse, I'm doing the RNDA adult and cannot do peds without a top-up. Life of a student nurse, I would love to hear from you, because also... I'll try and do this. As per UGC guidelines, this course cannot be pursued in distance mode because she said she did stuff online. So they offer this course only in regular modes. The administration process for nursing includes entrance exams, and interested students are required to take the test. Okay, so this is if you're going to do open university nursing. She couldn't have done a course on Northampton Uni where you have to access the course and actually physically be there and then do module work. That's my impression. I would love to know, how are you? My stepbrother went there. Life of a student nurse. I would love to know from anyone that's on nursing, if you've had poorly health, could you do it? Do you have to pause your learning, or can you do it online? Just a question there. Say if you, I don't know, suddenly came down with a huge airway and you needed to take a break from your course, would they say, oh, don't worry, you can do it online and stay in bed? Because my daughter had to pause. My daughter, due to ill health, physical and mental, she had to pause. You defer a year, absolutely. So as you can see here, okay, Life of a Student Nurse had 3 weeks off for COVID, but had to defer. You cannot do it online. Thank you, Channy. So again, this is not bullying. This is This is not bullying. This is pointing out facts. Northampton University does not do a paediatric course. As I say, it's got to be an additional top-up. If she went in 2017, we're talking COVID years for a start, when you're coming into the 3 years. So where was the top-up during COVID? She wouldn't have been out there because remember, she is very, very poorly. She is susceptible to the bugs. So I'm afraid she couldn't do it. She couldn't have done it. No way. So, debunked. One reason. Statement. It was called a statement. And it does not cover you for university years. Never has done. Never will do. You then apply for DSA. Number 2. The courses that you say you did don't exist. We've got the Northampton Uni up there. Big up Shoe Army. And number 3 is that you would have had to do a top-up course to do paediatrics, which would have took you into 2020, which was lockdown COVID, because of your age. Also, you cannot, for insurance purposes, go to university at 15. There are some exceptions to the rule. I'm not going to say that because there are. You know, like the maths geniuses, right? But insurance is really hard for those people. You know, like the maths wizards. You know the ones that can like do GCSEs when they're 3. Those ones, yes, they do go. Yes, there are exceptions to the rule, but it's actually very hard to do because of insurance purposes. My youngest daughter has a friend who is incredibly intelligent, like off the scale, and he can't even get into college early. He's took his GCSEs early, but he can't. Yeah, she said she went to uni at 15. Yeah, absolutely. What's that? But yeah. As I say, Anya's best friend is very, very intelligent. They will do their GCSEs early. They have done some. But insurances wise. And we were like, well, hang on a minute. We always see these kids. We always see these kids on the telly that are like geniuses that, you know, can tell you every single country in the world at the age of 2. And then they go to places early. Why? There's a lot that has to be put around that child. Obviously, they're in an adult environment, so safeguarding. They just don't like doing it. Insurance-wise, the world that we live in, they don't like doing it. Can parents pay? And if you know the type of kids you know the type of kids I know. I'm sure anyone could pay for anything if if the price is right and the support's put in place, but you didn't. Also, you were in Northampton. You're absolutely right. You were in Northampton. It is in the public domain. You were in St Andrew's Hospital, and they don't let you have the access to education. St Andrew's Hospital is quite a secure unit. They would have like a homeschool tuition in there, but they would not be letting you out to go to university. It's not happening. And my friend works at St Andrews, and I've got friends that used to work at St Andrews. So, yeah. I debunk that. Thank you very much. I thank you. Yes, Emily. I thank you. I thank you. Debunked. Obliteration? Absolutely I am. And there's stuff going on about that too. Yes, I am. Thank you. But I am. She said she didn't go to school. No, she didn't go to school because we had friends say that, like at 11, she dropped out of school because her mental health was poor and she was in those facilities. So she would have had home hospital tuition. The law is there that we have to educate children. That's the law that's there. If you're an inpatient in a hospital or a facility, you have home hospital tuition. So it's there. If you get excluded, you have home hospital tuition, because they've had to put these things in place, you know, and you can still take GCSEs, you can take all of that, but it's very different than going to university at 15. Cat Ma, so with my kids, because, you know, at the end of the day, when you have a chronic illness, there is times that you need it. So, right, bear with, let me just make sure I don't dox myself again, because, you know, I'm pretty good at that. I'm pretty good at doxing myself. No one needs to do it for me because I can do it myself. Just saying. Okay. Now, I wanted to talk about some of the medication and the reason why she might need to be replacing tubes. This is Gio's medication. Okay, she's kindly sent me some lovely pictures. Okay, I do believe this is lansoprazole. Now, these are dissolvable?
What's omeprazole?
This is, right, you're going to hear Gio in the background because, can you jump in the box to explain them?
Yeah.
Thank you. I'm not opening the boxes up yet, guys. I know someone's been patiently waiting in there, but I'm just going to, the Quasi family, I'm not opening the boxes yet. I'm going to get Gio to explain her medications. As a tubie.
Hi.
Hi. Can you explain? Because it's easier for you to explain as a tubie than me to third hand whatever. And I'll just eat a blackjack freeze dry sweet that you got me.
Could we have the first picture then, which is the box that I scribbled my name off?
You see the iron?
What? English.
You're so demanding.
Of course I am. No. Just don't dox me, because I don't know if that one. So this is omeprazole, but it's dispersible, so it goes in water, 40 mils of it, and it dissolves itself in the water. Obviously in a syringe. You can go to the next one now.
That one?
Yeah, so if you look at the very bottom of the picture, you'll see there's lots of beads in it. Now, omeprazole and lansoprazole for nasal gastric tubes are the devil of medications. They just don't dissolve. It doesn't seem to matter what you do with them, whether you put them in boiling water and let it cool, whether you put it in sterile water. Nothing you can do for nasal gastric tubes that are under a 10 FR, which is typical 8 or 10 FR, it will block it. So I'll show you the blockage now.
Can I just say, someone said, doesn't Kirsten grind down her meds?
It doesn't matter whether you grind this, it turns into beads. So this drug is a bead drug. She would have been given this type because whether she has a tube prescribed or not, if that is her way to take her meds, you can't as a human. It's your human right to take meds how you choose. if she decides she wants to do it by tube, then that's her right, and they have to give her meds that will work that way. However, this drug is the devil of medications for tubes.
Right.
So
which one are we going to? Are we going to the tube now?
Go to the tube. So this is the very bottom of the tube that lays in your stomach, and that is like the eyelet that allows to feed the fluids and the meds into your stomach. This is what it does within 3 days. It blocks the entire tube. You can't crush the beads down, so that's how it ends up. So this is possibly why she's constantly having to change tubes. Now, they won't give us liquid form of omeprazole or lansoprazole as adults because it costs too much money.
Because Jodie's just putting there, my daughter's J-Fed and she gets omeprazole liquid.
Yes, so with children, they will give liquid. Liquid's too expensive to give it adults. They tend to give us ones that dissolve on the tongue. However, because of my problems of why having a tube, I don't put anything in my mouth, just as Kirsten doesn't, which means she wouldn't actually be able to take it that way. She pushes it all in her tube. She's possibly the reason why everything's blocking.
Chandler says my aunt is 50 and they get omeprazole, but they're in Wales. You need to move to
I'm
Wales.
in England. I'm not moving. Sod that. It's too stressful. You know, with surgical tubes, it's different because the surgical tubes are a lot bigger. Like they start like 14 FR going up. So with surgical tubes, you can use these drugs because they don't block them. But you have to remember that our tubes are so long compared to surgical, and they're a lot thinner. So the FR, the French, is a lot smaller, which is why it blocks them. Lansoprazole is exactly the same. So can we have those ones, please?
I'm eating my sweet.
Yeah, crack on. Just put the pictures up so I can get out the box. See that this... No, go back. Go back. So this is the Oro dispersible tablet. So this, again, just dissolves straight into water. Go to the next one, sweet.
You're supposed to say slide change.
Change. So as you can see at the very, very bottom of that syringe there, you can see little white beads. These do not dissolve in water. So, and because they don't dissolve in water, again, you end up with tube blocks, which we'll show you. Next, please. So here's more of the beads. You cannot crush these. They do not crush down. I've tried everything I can with different grinders. It's just, they are meant to be beads because that's how, if you took apart like a typical tablet capsule of these drugs,
Thanks, Victoria.
it would be exactly the same. You can't crush them. They do not crush. So even in water, they turn into beads. And the next slide is what this drug does to a tube. So these tubes are well, I'm not sure where she gets this from, I'm prescribed. So this is what happens with lansoprazole that is prescribed for adults. It blocks your tube.
And so if she had an NJ...
So someone's just put here, hang on, I have lansoprazole and the beads do not go in us to block my NJ, but it does block my J tube now. So even with some surgical tubes, they're blocking them. These drugs are not made for tubes at all. They block everything. It's a nightmare. So her saying that she takes omeprazole, no wonder she's changing the tubes every couple of days. Like my tube, so I will tell you, I had a blocked tube last weekend, and I just said to her, I don't know how Kirsten does this. I just have no idea. You were very upset
changing it, weren't you?
I was gutted because it was meant to last at least another 6 weeks, and I can't do it. Like the anxiety of changing tubes. I only have to do mine like 4 times a year. Is that right? Every 3 months. And to have to change it every few days, nah, I'd be done for me. I couldn't do it. The anxiety is bad enough doing it 4 times a year. So it took me over an hour to actually change my tube to get the confidence and get the anxiety down to do it. But she's doing it every couple of days. So they just don't dissolve, these drugs. This is just how they are.
This tube on the screen right now, what FR is that?
That's an 8 FR.
8, okay.
So they changed me from an 8 to a 10. However, on a 10, it still blocks the tubes. So 10 is typically, obviously, you can't see me on screen, but Sal sees me all the time on the screen. So she'll be able to tell the difference from last week's size tube to this week's size tube. So yeah, it's just that these they just build, they don't actually go into the stomach properly. They block the islet, which then occludes the pump, and you just can't get nothing through it. There is a lot of comments here.
You got some. There's just a lot of what?
Comments. Keep going. I'm ignoring them.
There's a lot of comments indeed. Okay, so hang on. You did the lansoprazole
and the omeprazole.
Okay.
The other 2 that I sent to you was.
Yeah, I'm going to put it on now.
Okay. So.
Bear with, chicken. Bear with. I have to keep remembering that one phone you swipe down, one phone you swipe up, one you swipe to the side. It's just a nightmare. All these burner phones, I don't know how dealers do it. Do you know what I mean?
Got alarms going off.
You alright?
Yeah.
Okay, let me just do this.
So this, just for some context. You're alright. You can see it.
Hang on.
There, that's all you need. So, obviously everyone knows I was
I've got a
involved.
violation warning for flag for personal information.
How's it personal information?
Right,
It's an eBay thing.
Shall I restart?
Yeah, go on.
Back in. I'm so sorry, but it was flagged up. I had a violation, so I had to do that. I am getting addicted to eating these freeze-dried sweets, and this is not good because I'm going to be wired on coffee and sugar. And I'll be like this. Zim! 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 So let's not do that. It's mad, isn't it? It's mad how they can. Let me just make sure I don't show details that they might think is details. It might be a bot as well, yeah? So let me just sort it out before, Gio.
Yeah.
If I sort it out before I bring it back on screen, it might have seen information and a bot might have thought it was. I don't think they would have done. But let me just... what if I edit the picture? Can I do it there? Save. Save. Bear with, chaps and chapesses and any other. Right. And if my daughter's in, pick up the carrier bag. Right, let me just go to... If we can keep tapping that screen, let's get everyone back in. I'm so sorry, but unfortunately, the live was reported and I had a violation. We are just being factual. This isn't a hate live. My mods have been really good. If anyone's saying anything not nice about her, they are blocking, including my own sister. So don't think... So don't think that we don't, because my sister got a bit upset for me there when somebody went for her nieces. And if she's in the chat, she'll tell you. Literally, they just muted my sister's comments. Family, because obviously they went for they mentioned the nieces, and she's savagely protective. So you know. Thank you, Claire. I appreciate you, but please, yeah, don't bother, Claire. It's not worth it. She's not worth it. Don't rise to it. I am not bothered. My children are perfectly well and happy. Thank you. and they don't need their hand holding or their nose wiping, so it's all good. My children are not babies. They are fully grown teenagers. Right, I've just took off the eBay thing just in case, Gio, that a bot picks it up. All right?
Yeah.
Just in case it was that. I don't think it was, but you know what TikTok bots are like. Are you all back in? We're back. We're back. I know, Carmen, but my sister was being like, yeah, stay away from my nieces, because she's very savagely protective. But yeah, can I just let you know that it was actually, we do not tolerate hate on this creator. It's not bullying, and my own sister was muted. Ta-da! Thank you so much, Bones. Summer, thank you for the tiny diner and the roses, and Sally, thank you for the rose. Thank you. Yeah, she blocked my own sister. Well, she muted her, she didn't block her. Right, okay, you ready? Let's go back. So, we talked about this yesterday, and we are only talking about Kirstens. Can we put that out there, aren't we, Gio? We're only talking about Kirstens. Nobody else's tubes or bits and pieces, just Kirstens. We're back. We're back, Gio. We're back. You can't. It makes it look very, very white out, doesn't it?
That's all I needed you to say, to be fair.
Okay, go on then.
So, this would have been back in December when I was confused.
Thank you, Leah. Sorry.
Obviously, being a tubie myself, I was very aware what extensions you can get for NG and NJs. So I was confused to why she was using this sort of extension. So I decided to go and find it on the internet, which I found it on eBay. And I sent a message to the seller. Can I have the other picture, please?
Slide two.
Slide.
Technical assistance. Slide
Yeah,
two.
this one. So
Just
I
make it a bit
basically,
bigger
yeah.
so you can see.
You've took out, there we go. So I basically messaged this seller, as you can see, on the 21st of December 2023. And I just said, hi, I'm just wondering what sort of tube this is an extension for. Is it a G tube or an NG and J tube? Thanks. And they replied back saying, good evening. Thank you for your message. It is for a gastrostomy tube. Many thanks. So a gastrostomy tube for people that aren't tubies is a G tube. It's a PEG. So it's a surgical tube. It's not a nasal gastric tube. So I was kind of wavering at that point of why is she using these things? However, then I still stuck around because of other reasons. But what she's currently using isn't prescribed to an NG or an NJ. She says she's with Abbott. I spoke to my Abbott nurse about it and said, what is this extension? And he was like, well, where she got that from? Because this is not for nasal gastric. These are for surgical tubes. So I just kind of wanted to put that out there as well, because I know a lot of people have been. 1 second. What's up, Lou? Oh.
You didn't have to apologise to her. She was rude. She got muted, sister or not.
Oh.
Kin is kin and all that, but you know, rules is rules, Claire.
So I just wanted to kind of put it out there and just say that she would not have got hold of this. This is not something we get prescribed. Abbott don't even have a code for this for nasal gastric users, because I certainly can't get this. So
I'm just going to flick it again just so everyone understands if you're just coming back in, because obviously lots of people are just joining. Gio made an inquiry about the port.
The 2-port Y extension set is what it's called.
Hang on a minute. That's the extension that Kirsten has on her NJ tube. Nasal jejunum, because it goes in.
Yeah,
jejunum.
Emily, this is the extension she is currently using. It is not.
And as you can see, the inquiry was made.
It was back in December last year.
So Gio had a suspicion.
yeah, then her dad was around and confirmed that everything was true that Kirsty was saying. So I stuck around for another 8 months. Well, 7 months.
Because why would her
until I
dad
found
lie,
him.
right?
Yeah. I couldn't quite, like, my suspicions. I had suspicions a few times last year, but then because Dad kept coming on the scene, it was like, oh no, well, he's not going to lie.
And that's
So
what
maybe,
when we were talking to you, that was the first thing you say. You were like, but her dad says it's true. Her
yeah,
dad comes on camera. Her dad speaks. Her dad says this thing is true. So why you were just like, why would he lie? What
yeah,
parent would?
I struggled to accept what you guys were saying because her parent knows her better. And then I was like, well, it makes no sense to her dad's not getting anything out of this. Like, what's the payoff for Dad? Because obviously that's how my brain thinks is, well, what's the payoff? What is he getting out of this? Why would he need to lie?
I'm sorry, Reggie. I'm sorry. The Carsey family, it's now called factitious disorder, and I believe so.
So I just wanted to kind of put this out there because I remembered I had it last night and
Because a
gave
lot
it
of people
some.
were saying, weren't they? Oh, well, you can get connections, you can get extensions, you can get, and we are not disputing anyone else that's having anything else, but this particular extension is on her tube.
Yeah, it is right now.
Right
today.
now, this is on there today, and this is what it's for.
It's also very rare to have a clamp. So I went on holiday. When did I go on holiday? End of May. Well, 1st of June this year. And it wasn't until just before I went that they said to me, do not go in the swimming pool with your tube. And I was like, what? Keep it out of the water. And I was like, why? And they were like, because he might germs in foreign water. Like, you need to be really careful or you need to clamp it off. And I'm like, what are you on about? So we don't typically have clamps on NG and NJ tubes. You don't need them unless it's for a reason of infection. So I had to make sure it was
Swimming
up in my
pool,
hair.
that sort of stuff, maybe.
So shower isn't.
Bath,
The
though,
bath.
if you were laying in a bath now.
Yeah, possibly. I don't know, but there is ways, obviously, there, because what I had to do, obviously, you've seen my bobbles that I have, and I had to pin the tube up into my hair. Like, obviously, you'd never go in the ocean or anything like that with a tube, just in case water did get in, because it's going directly into your bowel or your stomach. Anyway, so these tubes, these extensions are not for nasal gastric. You can't get them, so she's obviously buying them. So I went to find out where she was buying it and messaged them myself. This is me. These are off my eBay account because I needed to find out for myself, and I did. And then the drugs, the medication, should I say, the prescribed medication, it's going to block a tube. Like, these are devil drugs known in the nasal gastric world, amongst a lot of tubies, that these are horrific drugs that are going to block. So that's all.
Roses and roses and stuff to Gio. Appreciate it. Thank you so much. Do
you need me for anything else?
And Liam Bones for the no, I think that's it. I think we've covered everything today. Have we covered everything that we spoke about this morning, Gio? Gio, before you go.
What? No, fuck off. I've got headphones in, so you're doing it on one phone and then you're doing it on here. Don't be mean. Sal. They can't even hear you now, so you may as well just kick me out of the box because I've took the headphones out and everything.
Love you.
I have no idea what you're saying. So
I said love you. 1, 2, 3. Whee! Louise, I couldn't. That was a Free Trust marshmallow. And they absolutely hate it, so I do apologise. That's one way to clear the room, isn't it? It's like really weird, isn't it? It's not pleasant to eat either. It tastes like... well, the live didn't go off, I got reported. I can't help it. I'm sorry. Not sorry. Don't forget, I'm sunshine, lollipops and rainbows. Right, we're going to have some people in the box, but I've got to be off in, hang on, about 20 minutes. Because I have kids and apparently I'm supposed to do stuff with them. Hello, Lucy. Is Lucy there? Why can't I hear Lucy? Can you hear Lucy? No. Lucy! No, you're really faint. No. Ah, hello? Hello? Have you got headphones on? Maybe take your headphones out? Sometimes that affects it. Thank you for the hearts. Oh, thank you for the and the potato cap and the hearts. Thank you. And for the heart mason. If you join my team, thank you very much. Lucy, are you there? Do you want to go back out and try and come back in again? Because we can't hear you. No, I can hear like... Right, let's kick her out. She can come back in. Alexa, play. Oh, someone was in the box, then they chickened out. Oh, man. Sunny, I'm using the filter because somebody said that I was... I'm not all sunshine and rainbows myself. And I'm saying... I am not sunshines and rainbows. I have a wicked dark sense of humour because that gets me through life. I never claim to be sunshine or rainbow or lollipops. So, yeah, Alexa, play. No one's there.
Sorry, Sex Alley, I've got to turn you up a bit. Hello.
That's my life. Chaos is me.
Can you hear me okay?
I can hear you okay. Lou, Chronic Nomads asking how does she join my team? You're on my team. You're on my team. Have you got a little thingy? Or do you mean a subscriber? I don't know what you mean. I'll get someone to tag you. And you're in my Discord too. Right, tell us about cellulitis.
Okay, so I have a rare skin disease. And in December, that flared to a cellulitis and I had to go to A&E. And then in July, it flared in both my legs, again, cellulitis. So that's 7 months, I think, between the two events.
Yeah. Katmar's old enough. Don't you worry about Katmar. She's old enough, not told. Katmar's in the Discord.
I am 28.
She's 28. She just sounds like a baby, but she's not because we text off the app as well. I know she's real.
I get nervous speaking, so it changes a bit. Sorry. But yeah, so because it was 7 months apart, and I've had to attend wound care. There's a thing called cellulitis protocol that I found out about. That basically, if you have it 2 or more times in one 12-month period, they put you onto a long-term antibiotic program. So as of Tuesday this week, I am on antibiotics for 6 months.
Do you know, I didn't know that because Taylor's had concurrent bouts. We've never been told that. So can you send me a message about that so I can ask her what they're playing at?
Well, my GP didn't notice, but wound care know about it. So maybe that was the difference. But the thinking of it is, it's like it's not the same as when you're on a week. So it's like a lower dose, but for a longer time period to hopefully prevent it reoccurring. And then in that time, they can investigate the cause a bit more. So I have to go lymphedema about it. So I was just, because she said that she keeps getting it, etc. And I just thought I would share that there is a protocol.
And she ain't on it. But obviously, because the
It's not the
debunking,
same.
not everybody knows it. I didn't know it, but I now know it. Thank you very much. She will now know it, and I'm sure she'll say she's on it.
My GP didn't flag it, but it was like, I don't know the names of the different levels of nurses, but like the top level of nurse came into my... Yeah, I think so. Came into my wound care appointment, asked me about it, and then wrote to my GP. And then the day after, I started my 6-month antibiotic program. Hooray!
Anne-Marie said it's a prophylactic antibiotics to prevent recurrent infections.
Yes.
Okay, thank you guys for telling me
And
that.
I'll message you. I'll message you about it.
Because obviously it's something that Taylor suffers with. Anya has, but not necessarily that she's had breaks. Obviously, she's had stuff that's needed surgical intervention for cleaning out the wound and packing.
Yes.
Which wasn't nice, can I just say?
No.
But no, thank you for that. I appreciate that.
No
I
worries.
appreciate that. Thank you very much. Thank you. And
could you kick me out the box, please?
So take your little baby. 5, 4, 3, 2, 1. Whee! Kick the baby. Don't kick the baby. Anybody else want to come in? You've got approximately... I can't see that. 10 minutes. You have only 10 more minutes off me before I have to go and I have to do chores. Can I just say, if you've not joined our Discord, please get the link. We've got some really cracking groups now where people have moved on from hi, my name is John and I have a daughter who has illnesses, to, he's not really in there, to like really like gelling. I swear down, I'm 28, Catmar says. She swears down. We've got a really nice group of people. And the recovery bookshelf, honestly, for anybody in recovery from mental health, from addiction, from just anything really, they're sharing their positive wins. They've come up with a playlist, a chilled playlist. Our Kira is the librarian there. I don't know if she's in the chat. Our Kira is the librarian then there, and they're coming up with playlists. They also did some work yesterday on like recovery, like positive things, and honestly I'm just like, do you know what? Oh no, she's not here today. Emmy, it is bloody lovely. It's honestly so lovely to see people, Emily, love the recovery bookshelf, celebrating their wins and being boosted and boosted up by others, you know, like, and it's such a positive space. It's only me. You need to just flag one of my mods and they will let you know. We also have send children, if you're a parent like me who has children with additional needs. That's a lovely community. There's just so much, and I'm so proud of it, because that's what I wanted. I wanted to create a village of people that we can share our skills, especially like parents and stuff like that as well. But even now, people in recovery, they're sharing their skills, they're talking. They're not therapists, but they're people that are actually just boosting each other's self-esteem up, being there, celebrating those everyday wins that might seem too small to others, but not to them. It's like, I managed to get out the house today with my husband and have a cup of coffee. And this person wrote, and I'm not going to name them, but the positive praise that person got for just doing that small thing was just so bloody nice. I was just so happy, I'm not going to lie. I was like, oh, they're really nice, aren't they? Them crafty people are in there with their clicking needles in the crocheting section. They're showing their wares. Somebody, I don't know if she wants to be mentioned for this, but I will say, showed us their paintings with coffee. They were painting with coffee. Oh my God, it was phenomenal. Phenomenal. I was just like, whoa. We have some really talented people in there. Oh, does she, Jean? They're all crocheting and clicking in there. If Matilda wanted to join, I don't have an issue, but I'd want you to be there monitoring her. Or if you go on, and then if she wanted to, if she has any things, my sister's in the clicky crocheting thing. She's very, very talented. I can't crochet. It's the only thing I can't do, and it makes me very jealous. I don't have a problem, Jean, but I'd need you to supervise her. And that's my deal with that one. I don't have a problem. But yeah, so my friend crochets animals. She's done like unicorns, octopuses. They're massive, huge, mathis. But yeah, it's, to be fair, I'm loving it. I'm loving these groups. I'm loving the positivity. I'm loving people building each other up. So get the Discord link. Get the Discord link. There's another one, Crafty by Jenny. That's another crafty person going in there. I'm not very good with live chat. Otherwise, I'm big at the... Emmy, the recovery bookshelf is honestly so lovely. It just seems such a nurturing space where everyone's really positive. So out of this shitstorm that has become KiKi... Oh, I see. I'll make you presents. Mr. Actor. Out of this shitstorm, which has been very traumatic for some people, and I appreciate that, we have created a village of positivity, not sunshine and lollipops, because there's quite a few of us with dark sense of humour in there, because, after all, presents for the crush. Like that. I've made you a Highland cow. Would you like a Highland cow? Someone called her out and she paused the live.
Someone is at the front door.
Someone's at my front door. I don't think it's anyone interesting. Right, I'm going to do Agadoo. Looks like no one's coming in today. That's fine, because I can finish. So let's do some Agadoo. Darkness is balance the light. Do you know what? That's my whole life. Yin and yang. Yeah, yin and yang. You know, we could sit here and be very sad that we have what we have, or we could celebrate the positives. And in that group, they are celebrating the positives, and I love it. I can't speak highly enough of it. For anyone asking...
The Observer, providing you with the latest TikTok drama from across the UK.